Nearly 1 in 3 childbirths in the U.S. happens through cesarean section or C-section. But as maternal and infant deaths hit alarming numbers in the U.S. and here in New Jersey over the last several years, there's been a major effort in the state to bring down the rate of C-sections. And it seems to be working here in New Jersey. Joining us now to explain what's working is Slawa Rokicki, who led the analysis at the Rutgers School of Public Health. Slava, thanks so much for being with us today. Now, I know that researchers at the Rutgers School of Public Health have been looking at the rates of cesarean section here in New Jersey. First, just help us understand what you're looking at and how the rates have changed recently.
Yeah, thank you. So we've been looking at the rate of low-risk cesarean birth, which is a measure of the quality of maternal care. In general, in the U.S., the rate of cesarean birth has been rising. It's gone up from about 20% back in the 90s. It's now at about a third of births are cesarean. And the worry there is that many of these are unnecessary cesareans. So
when you say low risk, you mean elective. So in other words, someone choosing to have a C-section rather than a vaginal birth?
Right. So not necessarily. It could be elective. It could be that the provider decided during the process of labor to encourage the woman giving birth to choose the cesarean delivery. So by low risk, what I mean is what this measure called NTSB. So it's nulliparous, meaning the first birth that a woman has. It is singleton, so not twins or multiple births, but a single baby. It is full term, and it's in the head position down, vertex position. So that is kind of the measure that we look at to determine whether it's low risk or high risk.
Why is the increased risk of C-section a concern nationwide?
Yeah, so when women have cesarean deliveries, they are at higher risk of some poor outcomes, complications like infection or blood clots, complications of anesthesia and surgery. They can result in also increased risk of neonatal respiratory issues, as well as difficulty breastfeeding. There's also emotional toll from having unnecessary surgery. So there's quite a few negative outcomes and no real benefits for these low-risk cesarean deliveries. Cesarean can be, of course, an important tool that an obstetrician has in their toolkit for maternal health, but in cases where it's unnecessary, it's not positive for maternal health. Yeah.
We know that with the Nurture NJ initiative that was rolled out at the beginning of the Murphy administration, there was a big push to reduce low-risk cesarean C-sections here in New Jersey. What is the state doing right to bring those numbers down?
Yeah, so that's what we have been looking at in our policy brief, and we have found a good deal of progress that New Jersey has made in reducing their low-risk cesarean rate from 30% back in 2016 now to 27%, which is a 10% decrease. And it is a substantial drop when compared to other states, which over this period of time either increase, because COVID happened during this period of time. There's lots going on. Many states saw their rates increase or stay the same, while New Jersey saw a big decrease. So something is going right in New Jersey. And there's been a range of policies that Nurture New Jersey has implemented. So, for example, one of the ones is prohibiting coverage of elective cesareans in certain non-medically indicated situations under Medicaid and under the state health benefits program and school employees health benefits program. So that's been an important factor in this drop. There's been other policies as well. So increasing access to doulas, and doulas have been found to advocate for their patients, for their clients, and in reducing cesarean delivery. There's increased access to midwives, and again, midwives are associated with lower rates of cesarean delivery. So there's been quite a few different policies that have come together to result in a lower rate now that we've had in the past.
Yeah, it certainly signals a move in the right direction, although we know that not all women have seen the same. Women of color have not. We'll have to leave that for another day. We are out of time, but Slawa Rokicki with the Rutgers School of Public Health, thank you for that insight.
Thank you. Thanks for having me.